Welcome back to week 5 of Nursing 305 Trends in Professional Nursing. I'm John Dyson. This week we're going to discuss the nurse's role in genetics and genomics and the impact that arrives from informatics. In the ANA's Genetics and Genomics Scope and Standards of Nursing Practice, it very clearly states that all registered nurses, regardless of their practice setting, have a role in the delivery of genetic services and the management of genetic information. So, nurses, and therefore in the provision of nursing education, nurses require genetic knowledge to identify, refer, support, and care for patients who are experiencing or could be affected by or transmit genetic conditions. Nurses are the go-to person for questions. We know that. We see it in our families, our communities, and patient knowledge in these areas is growing quickly thanks to information available from the internet, which may or may not be the most accurate information that they could receive. Does that mean you have to be a genetics nurse? Well, a genetics nurse is a separate specialty, just like being an ICU nurse or a med-surg nurse. However, it's an interpersonal relationship between the patient and the nurse. Enter the concept of personal health information and the appropriate dissemination of PHI discussed earlier in this course, and it really becomes an interesting mix. Just a little refresher here, genomic care, as you see, is ensuring that the influence of a person's genetic history on health and disease is considered as part of the general assessment information for all patients and families. We should be assessing for that already as part of better understanding our patient and their patient's family history. Healthcare professionals simply cannot overlook genetic issues. There's lots of promises that are coming up there. What if a patient approaches you, the RN states, this internet site says they can establish without a doubt what I might die of and when this might occur? Well, there have been a number of genetic companies that have come and gone making claims, some legitimately, and some unfortunately not so legitimately. You may likely have to help your patient make some important decisions there. Some of the important questions that need to be asked when you're looking at the types of genetic testing being offered by these companies include: which genes are they looking at? What type of genetic testing are they doing? Are they only looking for common mutations and or polymorphisms? What research studies have they used that support the associations the company plans to make? And what is the validity and clinical utility of the genetic test being offered? It sounds a little complex, but when you look at it, is it legitimate? Now, a red flag might go up when your patient starts asking questions about complex genetic disorders, especially when assessing the claims of companies that offer genetic testing for them. A more appropriate measure might be the referral of these patients to the genetic professionals. As your textbook notes, genetic testing for genotype targeted therapies for obesity, cardiovascular disease, and other complex diseases are in various stages of basic and or clinical research. However, there are companies already marketing claims that they can tailor nutritional supplements and provide lifestyle recommendations based on the results of their exclusive genetic tests. Now, please note, in no way am I saying that they are all fraudulent. In fact, there are probably some up and coming good ones that should be paid attention to. But nurses serving as a patient advocate must help patients investigate the credibility of these claims. It is known that certain alterations in certain genes, such as the CYP2D6, the VKORC1, the CYP2C9, and others, impact metabolism. Clinical studies Genetic professionals are those who have extensive education and often special credentialing in some aspect of genetics. But all healthcare professionals are expected to have a basic understanding of patterns of inheritance and genetic terminology. That's supported by the American Nurses Association and is also a requirement now for education within a college setting for a baccalaureate degree. Genetic counseling, as you see here, the process of helping people understand and adapt to the medical, psychological, and familial implications of genetic contribution to disease occurrence or recurrence. That's by the National Society of Genetic Counselors. In other words, it's sort of what we do already, making sure that they know what's being talked about and what they're looking at. Non-directive counseling is, as you see, presenting all the facts and options in a way that doesn't promote or exclude decisions or actions within the legal boundaries of our nursing scope of practice there. And this is what we as nurses do already anyway. Try to present patients with information so that they can make their own decisions while still serving as a patient advocate. Now, certified genetic counselors take another step there. First off, it's a genetic professional who has a master's degree in genetic counseling from a graduate program that has been accredited by the American Board of Genetics Counselors, and they've passed a certification exam. The genetic counselor's scope of practice includes providing expertise in genetics, communicating and counseling patients and families who might be at a genetic risk, and ensuring that counseling services are delivered in such a manner that is consistent with professional values and ethics. This differs from a clinical geneticist, which is usually a physician who has graduated from an accredited school or college of medicine, has successfully completed a medical board examination and is eligible for licensure to become a clinical geneticist, has completed a clinical specialty residency, and has completed a clinical genetics fellowship. Now, a clinical geneticist sees patients with a wide variety of genetic disorders, diagnosing, clinically managing the care of those patients, and providing counseling. And they may be certified in cytogenetics, molecular genetics, or biochemical genetics. A clinical laboratory geneticist has their own qualifications, such as you see here. They oversee and work in laboratories that perform genetic tests. They develop and implement new tests. They provide quality assurance of routine tests and interpret the test results that come subsequently. And they communicate the results to healthcare and other genetics professionals. That again differs from a medical geneticist who is not a physician, but they do have a PhD, a doctorate, most commonly in population genetics or epidemiology. They work with genetics counselors to provide accurate recurrence risk information, and they end up often teaching in academic institutions. Certainly an important function to help provide the training that nurses and other healthcare professionals need to help provide this type of care. And there are research geneticists there. These are usually ones that are possessing a doctorate in genetics or relevant biological science and have completed postdoctoral laboratory training in genetics. Now, they may work with a clinical geneticist or a certified genetic counselor to provide the scientific details that might be associated with a specific disease or disorder. Advanced practice nurses who are in genetics have a master's degree in nursing from an accredited program that includes 50 hours of genetic content at a minimum. They need to have 300 hours of supervised genetic practicum experience, very common with advanced practice nurses, but especially in the genetics field. They must provide evidence of effective teaching and have certification through the construction of a professional portfolio. And there's the clinical genetics nurse who obtains certification, again through a professional portfolio. They are a licensed registered nurse who has a BSN. They need logs of 50 cases and 4 case studies that reflect the standards of clinical genetics nursing. And they need 45 contact hours of genetic contact from academic coursework or from continuing education. Then there's The remaining nurses, the role of the general nurse in genomic care. That nurse verifies information to bring a genetic problem to light through the assessment techniques that we've talked about. They look for cues that signal genetic problems. They provide accurate information to other members of the healthcare team to make sure that things are being relayed properly from patient's mouth to their ears. They ensure referral to genetic professionals occurs. They serve as a patient advocate while maintaining confidentiality. With that, I'm going to ask you to read the article in the link that is provided right after this video there, introducing a new competency into nursing practice.